The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Thank you for joining us on this webinar. We're going to give folks 2 or 3 more minutes to hop on, and then we will start with the webinar. Thank you all. Good afternoon, everyone. My name is Lauren Robertson, and I'm the Digital Advocacy Manager at Child Care Aware of America, and I'm going to be guiding you through today's webinar. This webinar is being recorded, so if you have to bop off early or have to step out, don't worry. You can always listen to the recording later on, and we'll also make sure the resources are available. Today, we're so excited to bring you this webinar to talk about how to share your message in early childhood advocacy. Today, we are going to introduce who's on the phone. You'll hear a series of voices, and we'll make sure you know who everyone is. We're going to set the scene and talk a little bit about the legislative process, and then we will talk about effective storytelling and advocacy and how to use your story to impact change. And then we have our social media manager from Child Care Aware of America on to talk about how to use social media to amplify your message. And then we have a couple next steps for you all. Today, we want to make sure that you all leave this webinar with messaging and storytelling skills around infant and toddler issues. For advocates, for providers, and early childhood organizations, whatever one you fit into. If you fit into both or multiple, that's cool too. We also want you to leave this webinar with key strategies to build your social media presence and establish ways to amplify your message, whether that's with your organization or with your personal account. A couple of housekeeping items. Please ask questions throughout the webinar via the chat box. I will be actively monitoring the chat box, so as questions come up, I will make sure that the speaker hears them and can respond to them. Like I said, this webinar is being recorded and will be available after the completion of the webinar. Everyone will be on mute just to control noise, and we have 6 poll questions throughout the webinar, so be ready to participate throughout. I want to give a little bit of background about who I am and what I do, as well as our staff on from Child Care Aware of America. Chrissy West, our Director of Advocacy, will be speaking today, as well as Liz Twilley, our Social Media Manager, and we make up the Child Care Works team at Child Care Aware of America. We are focused on child care advocacy. Child Care Works is not a campaign, but a long-term movement towards quality, accessible, affordable child care for all across the country. Chrissy, Liz, and myself do a variety of things throughout the country, focused on child care advocacy, and we're really excited to be here today in partnership with Child Care Aware of Washington, the Children's Alliance, and Think Babies, who is our funding partner to focus on child care advocacy, particularly infant and toddler issues, and support you all in your advocacy. Our first poll question today just helps us know who's on the call. We really would love to hear who you are and what best describes your role. I'm launching the poll now, so let us know if you're a CCR staff member, a child care provider, a parent, and from another nonprofit, or if you're other. If you click other, we'd love to hear from you in the chat box. All right. So it looks like 2/3 of you are CCR&R staff and 1/3 of you are a child care provider. So it's a good mix because everything we're talking about today can be used from a CCR&R perspective, since that is what Child Care Aware of America comes from their membership. But also we are all about building the voices of child care providers and how CCR&R can better support child care providers as well. So excited to have you all on today. So now we're going to set the scene, and I'm going to pass it over to Chrissy West, our Director of Advocacy, and she is going to speak briefly a little bit more about Think Babies. So if you don't know the background of Think Babies from the national perspective, they are our funding partners through 0 to 3, as well as Cameron can chime in, Cameron Joy Kurtz, who is from Child Care Aware of Washington, and he can chime in with any Washington-specific things as well. So Chrissy, passing the baton on to you. Oh, looks like Chrissy is muted and cannot unmute herself, and that is okay because I will briefly discuss what Think Babies is. We are both very familiar. So like I mentioned, Think Babies is a campaign from 0 to 3, a national nonprofit that focuses on early childhood issues, particularly around children 0 to 3. Cameron, I forgot to change this. The Think Babies campaign is expanding in 2019. It started 2018 and has 6 state partners throughout the country that Child Care Aware of America has been working with. It has 4 policy priorities at the national level. As you can see, it's really about focus on 0 to 3, and Chrissy and I and Liz focus a lot on this quality affordable childcare part, but we're also here for how that all the other policy priorities interact with the other ones. Think Babies is really science-based. They really emphasize the importance of brain development, which you all know about, and they have campaign strategies including events and online campaigns to really achieve their campaign goals. These are their federal policy solutions that they're focusing on at the federal level, like I said, but each state that is a Think Babies partner also has their own priorities as well at the state level, and they all kind of work together for young children and families. And that is a little bit about Think Babies, just to kind of frame our discussion today and why we're focusing on infants and toddlers especially, and why it's so important for us through this project. I'm now going to pass it over to Jake Stewart. He is our policy manager for governmental affairs and policy manager. He's a very long title, and he just got a new title, so I keep messing it up. And he's going to talk a little bit about the legislative process. This is, I know some of you have heard this before. This is kind of the federal level, and want to make sure that we just all level set so we understand a couple of things. Before I pass the baton to Jake. Just have a poll question for you all of how familiar you are with the legislative process. Are you very familiar, somewhat unfamiliar, or very familiar? No matter how you feel, today we'll be briefly covering it, but also we'll go into some other things. And if you want to learn more about the legislative process, we'll be sure to include resources in our follow-up email. Alrighty, so it looks like some folks, like a quarter of folks are very familiar, half of folks are somewhat familiar, and a quarter of folks are very unfamiliar. So hopefully Jake will give you a good overview that will bring you up to somewhat familiar, and then what we talk about today will be embedded into that as well. So over to you, Jake.
All right, thanks, Lauren. First, I'm going to start off talking about the general budget timeline that the Senate has, or that Congress has, when it comes to government spending. Now, this is assuming that everything runs on time. Over the past few years, that has not been the case, especially with the shutdown, and a lot of people are wondering how the spending process is working now. But normally, when things work correctly, in early February of a given year, the president will submit their budget request to Congress, and then by April, Congress completes action on the budget resolution. And after that is when the House and Senate starts to consideration of the appropriations bills. And it's during May through July normally that advocacy around spending measures, particularly CDBG, and any other government funding measures really picks up in a normal year. And then on June 30th is usually the target date for the House completion of all the appropriations bills. And then usually the Senate will take up those appropriations bills as well. Their goal would be to have everything passed and signed into law by September 30th. And then October 1st is usually when the new year begins. However, usually this timeline, well, not in the past few years, this timeline has been getting thrown off. Mainly because Congress has come to a stalemate on coming to agreements, not necessarily just on CCDBG, but on a number of different issues that really stall up the process. In this case, or in the case right now, it's immigration. And so what that meant for last year is last year in February, Congress reached a 2-year deal. This was a 2 fiscal year deal. So they were already really behind on the fiscal year 2018. And so they reached a 2-year deal, which actually led to a historic increase in CCDBG funding. And then the next month they passed fiscal year 2018. That was in March. And as you can see by the timeline, it says that usually in September, October is when they should wrap it up. So they were about 5 months late on that. And then they were running on time this last year. Congress was actually, in terms of appropriations, up until the wall became an issue, Congress was actually working really well in appropriations. 5 of the 7 bills, 5 of the 12 spending bills were passed last September, and were actually, by September 30th, were written into law. That includes the Labor and Health and Human Services spending bills. So that includes CCDBG. So CCDBG is not affected by the shutdown. However, 7 other spending bills, including the Department of Agriculture, which houses SNAP and WIC funding, in addition to 6 other spending bills, were not funded, and that's why it's a partial government shutdown right now. So, we're unsure what that's going to look like now. I know maybe some of you were paying attention today that the Senate just voted on 3 different bills to reopen the government, and none of them received 60 votes. The Democratic proposal received the most votes of the 3. There were 6 Republican senators that voted in favor of that broke with the party and voted in favor, but none of them achieved the 60 needed to pass. And so we're still Unfortunately, moving on with this shutdown, and but at least the Senate is finally starting to vote. These are the first bills the Senate has voted on to try to reopen the government. All right, you can go on to the next slide. So I wanted to just briefly talk about some issues related, other than CCDBG and funding, some issues related to federal legislation that we look at. One of those issues, or the issues you see before you, are issues that we do a lot of advocacy for, and that really directly impact the work of CCR&Rs, child care providers, and really the families that we're working for. So TANF is a big one. States can tap into 30% of TANF funding to fund childcare. By the way, TANF just received, was just extended through June 30th. It's kind of been on an extension for a while now. It was not passed before the government shut down, but the Senate did just pass it. It's awaiting President's signature. We'll see if that happens. But there was some concern about TANF funding not being available for childcare. The Child Care for Working Families Act was a big one that we were promoting last year. We are awaiting its reintroduction this year. I'm sure you all are very familiar with that, given that Senator Murray is one of the leads on the Child Care for Working Families Act in the Senate, and it has become a huge messaging point to try to make child care more accessible for all families. So we will be pushing that when it gets reintroduced. The CACFP, the Child and Adult Care Food Program, very important for providers. And we have received word that it should have enough funding for at least all of February and possibly through March. But we're trying to monitor that closely during the government shutdown. The PACE Act, this is a little, I should have updated these actually. The PACE Act was a tax measure to make the child and development care or dependent care tax credit fully refundable. But I should just say, in general, we support tax initiatives that really assist families, and we support progressive tax initiatives, not regressive tax initiatives. So obviously, we're focused on helping your lower class families and working class families being able to access it. So the way that the tax credits were structured in 2017 tax bills that we supported, but usually we aim for more progressive tax structures. CCDBG background checks. The reason why we flagged that is that a lot of appropriators are really starting to focus on background checks, especially Republicans. Our goal this year is to try to get even more funding for CCDBG on top of the increase for last year. And, Democrats are usually in favor of the program. Republicans are usually harder to convince, not all the time. We found that background checks are a great way to kind of start that conversation with those Republican offices that typically don't necessarily like giving out a lot of federal funding. And a lot of states are trying to get up to speed on the background check provision of CCDBG. So with Republican offices in particular, we're finding that that's a more effective way to enter the conversation. And the last thing is infrastructure legislation. And this has actually become really interesting over the past month. Childcare infrastructure is starting to become a hot topic within the federal government. And what's great about this is a lot of working mothers in Congress that are trying to draft legislation to address the childcare infrastructure issue. They're really looking at the lack of supply of childcare, a way to support the workforce, support childcare providers, in addition to helping with update facilities and assisting with professionalization of the workforce. I will talk about that in a couple of slides because we do have a target representative for Washington that we're trying to get on board, but we will keep you up to date with those measures when they get introduced formally. So the slide I just covered were some more directly related issues in childcare, but this is more of an indirect issue. These are indirect issues of childcare that we still do advocacy on. So that includes the census, which has to relate to funding. the public charge rule, other infrastructure options, paid family leave, the Farm Bill, and the Child Nutrition Act, just to name a few. So even though these aren't directly associated with childcare, we do think that they're important for our overall cause. Finally, I just wanted to talk about one specific opportunity with Jaime Herrera Butler, and a representative from Washington, as I'm sure many of you know. We are trying to get her on board with co-sponsoring some infrastructure legislation. She's actually been supportive of our cost of care report. She co-sponsored the PACE Act last year. She's reviewing some infrastructure legislation, and if you are in her district and you are interested in wanting to give her a little nudge of support in that direction, you can actually reach out to Ryan Preco and get connected with him, and we will give you a method of being able to kind of nudge her to co-sponsor some legislation that we're looking at.
Awesome, thanks, Jake. And we'll make sure to include that opportunity in the follow-up email as well. We're gonna dive into our training topics today, and I just wanna thank Jake for kind of giving us that federal landscape. I know for some people it was really wonky, for some people they knew all that stuff. I think sometimes it's good to frame advocacy in terms of policy and our opportunities. We know you all are working at the local, state, and federal level, and so your local and state perspectives are really important, and we are happy to be a resource at the federal level as well. So before we fully dive in, I wanted to see how you all feel about effective storytelling for advocacy. This is an important topic because we talk about all these policies, we talk about all these problems, but the way to sell solutions to these problems is through effective storytelling. So I wanted to see how you all feel, how confident you feel, and this is really up to you. The first one is, how confident are you in your storytelling skills for advocacy? Very confident, somewhat unconfident, or very unconfident. I can tell you that even though I train folks on this in my own skills to tell my own story, I would put myself at somewhat confident. So it really depends on how you feel, and hopefully after today, we'll move you to be at least a little confident, if not very confident, in your storytelling skills. Alrighty, it looks like 50% of folks are saying they're somewhat confident, which is good. I hope to get you to very confident. Some other folks are saying very confident, and then some folks are saying they're somewhat unconfident or very confident, and that's okay. I think today's slides will be a really good overview and also give you some really tangible ways to take the skills and out into the world, which is what kind of my follow-up question around how confident are you in helping others tell their story. A lot of the times I don't have to tell my story, but I have to help others tell their story, and I feel very confident in that. I feel the training and talking to folks and coaching people, helping people tell their stories is a really cool opportunity to spread the word and get those messages out there. Alrighty, looks like about a third of you are very confident, which is great. And so hopefully the resources we have today, the handouts we have today, will be good tools for you to continue to be very confident. And then it looks like 3/4 of you are somewhat confident. We hope to get you to very confident today. All right. So when Chrissy and Liz and I were designing this webinar, we think a lot about how important storytelling is, but I wanted to touch briefly on why storytelling. Why is storytelling so important? When we consider the basic definition of advocacy, it's the act or process of supporting a cause or proposal, and storytelling is almost always a part of that process, whether directly or indirectly. If you think of any policy or law that you know, no matter how mundane, there's probably a story behind it. When we frame our experiences and perspectives into an effective story, we can impact others' decisions, including and especially policymakers who are seeking out input from their constituents. I think it's especially important to note that sometimes policymakers don't know that they need the input from their constituents on certain issues, but as advocates, you all can be those people who tell the policymakers that they do need to know about childcare and infant and toddler issues in early childhood. I put up 2 pictures on the screen. One is Mothers Against Drunk Driving, and the other is AT&T's It Can Wait campaign. And these are two campaigns based around very similar things about drunk driving and then texting or distracted while driving that are really based on stories. They have achieved, Mothers Against Drunk Driving, for example, has achieved tangible policy changes based on their storytelling. For example, they changed the legal limit for drinking or for drinking while driving from 0.1 to 0.08. That was a big policy change, and it was stories being told to policymakers at all levels of government, and hearing those stories connected to a policy change led to change. So thinking about these examples, I put up these 3 questions, and I've done this in different trainings as well. When we think about storytelling, I like to think about who has a story to tell. I think a lot of times we hear the same stories from the same people, but thinking about whose stories might be missing. What are those stories about? There are multiple stories in early childhood. We know costs, we know access, we know all these things, and everyone has their own story to tell, and we encourage you to share it. And we also think about who should hear those stories. We emphasize a lot about policymakers need to hear those stories, but sometimes the first step might just be the public being educated about early childhood. Policymakers, but also the media as well, and making sure that the stories that the media is telling are true and reflective of experiences of people who work in early childhood. So I just put this slide in here to frame the rest of our time together on effective storytelling, and to keep in mind who might be missing from the child care advocacy table, and to think about big areas we want to impact change and connect our stories to solutions. So keeping the storyteller, the problem you're trying to solve, and the audience in mind, this 3-part framework is really the backbone of impactful storytelling. Chrissy will be touching on different models for how to frame your story and how to practice your story. And those different models are really based in these 3 things. Both of these models are useful and important, but they are different in different ways. One relies more on data, and one relies more on emotions, but they start with the basics, who the story is about, what the problem is, and where this is happening, and then they move into the challenge, what is causing this problem, and then they offer a solution. The solution is key because policymakers need to know a solution to the challenge so that they can take action and make change. So I'm going to unmute Chrissy, and she is going to talk and not have any issues to go further into talking about effective storytelling, messaging, and different models you can use to become a star at effective storytelling and also help others become stars at effective storytelling. Chrissy?
Thank you so much, Lauren. I'm here, and my mute is not stuck anymore. So we're going to talk a little bit first about audience and keeping in mind your audience, creating messages for them, and testing your messages. So once you have the background, the challenge, and the next step, you have to consider the messaging of your story. So when we're thinking about what Lauren was talking about, who should hear these stories, we need to consider how these different audiences are going to respond to the different messages. You might have a policy ask or a goal that has a few different messages based on the audience you're addressing. For example, you have one piece of legislation. You're approaching a conservative legislator or you're approaching a liberal legislator. You have to think about what the selling point is or the place of agreement for each of those 2 different audiences on that same piece of legislation. So one of our story messaging models actually will kind of take that into account. And before you bring your story and message to the masses or to the key player, lawmaker, media, whoever it is, it's important to test your message out. So make sure you're not missing something that could be hurtful or offensive or even just not effective in getting the point across. A lot of times in early childhood, we deal with, especially at CCAOA, a lot of our family advocates have infant loss stories, and it's really hard to talk about. We never try to tell the advocate's story for them because it's a really personal story, and that's something that you want to keep in mind when you're trying to maybe help them or bolster their story in some way, that you're not stepping on them or using messaging that could be hurtful or undermine their story in some way. So it's just important to kind of test your messaging, make sure that you run it by other people, say it out loud. You know, if you want to practice, that's even better. Just to kind of keep that in mind so that you know your audience and your story. We always want to pair our story with facts. Lauren, can you go to the next slide for me? Thank you. Pairing your story with facts. So we want you to steal from us. CCA of Washington, I'm sure, would be happy to have you steal from them as well in any materials that they produce. We have state fact sheets that break down state access and cost data points for the state of Washington. We also have Parents in the High Cost of Child Care report that comes out every year. So just making sure that whichever story model you're using to tell your advocate story, that you are bolstering those stories with facts where you can. It's really important. We talk all the time about how it really is the personal, but it's learning how to tell that story in a personal way where you are incorporating data points or facts or pieces of information that are generally agreed upon in the common environment. Next slide. So the first story messaging model that we use is called the messaging triangle. You've probably seen this before. It's used in a couple different ways, but basically this is what we use to support our family advocates at the state and federal level. So the triangle model visualizes the chart that we'll be going to next, actually, and it shows how one part can't work without the other, and each kind of supports each other. So when we think about impactful stories, it's important to remember the problem, like Lauren said, what we're trying to solve, the opportunity, that's why is now the time to take on this issue? What makes this a good time to deal with this? And the solution, what can we do to fix this problem? I always remind people to never, ever, ever go through the process of putting your problem out there, especially for someone like a legislator, unless you're also offering a solution. If you don't have an exact solution like HB 242, you want to push that out there. If you don't have something specific, even to just say, we need to address costs for families, or we need to address access in rural communities, whatever the issue is, you need to bring it to a point for the legislators so that they know what this is that we're trying to do. Next slide. So this chart is actually the data version of that triangle. And I know it looks like a lot. This is our more data heavy of the two storytelling models. So under problem, we first define the problem in that top row. So one of our family advocates, they had to drive 90 miles back and forth each day to take their kids to a high quality preschool, and it cost more than their monthly mortgage. That's a huge issue. That is a lot of money. It's unsustainable. So underneath the problem, we want to put in 2 data points or facts or stated points of common agreement. So in most states, childcare costs more than college tuition. That's a fact from our cost of care report. And then the second is that parents need tools to understand and evaluate quality of their childcare options. That's just a common understood data point. So if you work in R&R, and probably if you're a provider too, you know that parents don't even know what they don't know. They don't know what quality looks like oftentimes. They don't know what they're supposed to be looking for. So they need tools to help evaluate that. The opportunity. Why is now the time to deal with this issue? So we use this example as midterm elections drove more diverse candidates to run for office, and specifically more women. And because women seem to be putting this issue more front and center in 2019 already, with some of the legislation that's already being proposed or talked about, we want to make sure that we take advantage of this and use this momentum going forward to advance our cause. So 2 data points. We had the highest number of women candidates ever in 2018, and there are now 132 women in Congress, which is the highest number ever, which is great. And that this is a bipartisan issue. So both parties have legislators and nominees talking about affordable to quality childcare. Those are the 2 data points behind why now is the time to talk about this. And then the solution. Our solution in this instance is that we need increased funding for CCDBG for subsidies and covering increased costs for providers to comply with 2014 reauthorization of CCDBG. So for all of you dealing with the angst of all of those great new regulations that we fought for in the reauthorization, you're probably also dealing with increased costs. We realize that we need more funding to help providers and R&Rs deal with those increased costs so that we can support these changes we wanted to make. So we just have 2 data points that we put in here. And when you're crafting your argument, you don't have to just use us as a source or CCA of Washington. We go to plenty of outside sources. So one data point could be that for every $1 invested, society reaps $13 in cost savings down the road. That's often really great with a more fiscally conservative legislator because, you know, they're talking about budget savings in the end, and so that's really more of an investment for them. And a second data point could be 90% of development takes place in the child's first 5 years, so we need to invest in those years as quality, not just, you know, sitting a child down in a bobby seat and staring at a TV all day. That's not quality childcare. That's not what we support. So basically what we're doing is weaving these data points as we tell our story. I wish we had a family advocate here to actually share this story, because she really does a great job of telling it, and I would not do it justice. But, you know, I would share my story. I would say, you know, my family drives 90 miles back and forth each day to take our 2 children to a high quality preschool. There was nothing in our area that I considered to be high quality. And so in order to get that for my children, we have to drive 90 miles back and forth. It costs more than our monthly mortgage. And that's not unusual in most stage. Childcare costs more than college tuition. I was lucky. I know what I'm looking for in high quality options, but a lot of parents don't. They don't know even what they don't know. So the reason why we need to do this now is because we have a lot of momentum with all of these women in Congress who are talking about early education and childcare, and we have nominees and lawmakers in both parties who are discussing this issue, and it's a priority for them. Our solution is that we would like to ask for increased funding in CCDBG to help parents and families afford expensive childcare, and also cover the increased costs for providers who are trying to offer high quality care. We want them to be able to do this in a way that's sustainable for them, so that these providers can stay open. And this is important to invest in now, because for every dollar we invest in early childhood education, society is going to get $13 in cost savings down the road. So we realize we need to invest in these years, because 90% of development takes place within a child's first 5 years, and we just don't invest in those enough. Obviously, that was very clumsily done because I'm reading off of my slide here, but when you're telling a genuine story that's personal to you and you know the details, you're able to much more smoothly kind of weave those pieces in. And again, like we said before, this is the more data point heavy of the 2 models. So if you have a story like an infant loss story or something that's a little bit more emotional, we do have a different model for that. And so we'll talk about that one now. And this one has a really cute name. It's called the Gingerbread Model. And by the way, we have worksheets for these included in the webinar that you can download. Actually, they're under the handout section, so you'll see those if you want to follow along or look at those later. So the Gingerbread Model has 3 pieces. You appeal to the heart, that's the personal aspect of the story. You appeal to the brain, that's the facts and the research that you want to put in to back up your argument. And then you want to appeal to the need to act, and that's the need for the want to do something. So Amber and Travis's story, the story that I just shared previously, was personal and focused more on facts. This one is a little bit more heartfelt, and like any good convincing argument, you still need to appeal to, you know, the heart, the brain, and the hand to give an opportunity to the audience to act. So I'm going to share just very briefly the story of one of our other family advocates in California. And she talked about her story when she was meeting with lawmakers. Her infant daughter actually passed away in childcare due to an unsafe sleep situation and a provider that was just not trained properly for infant CPR and, you know, trying to resuscitate her daughter. So she ended up passing away in care. How she told her story was sharing how painful it is to lose a child, and the fact that it wasn't necessarily the provider's fault. It wasn't negligence or malice. It was just not knowing. It wasn't knowing how to do the things that she needed to do. The reason why this is an issue now is that we really need to deal with training for providers, especially health CPR, and especially infant and newborn CPR training for providers, and safe sleep. We want to make sure that all providers are funded and trained and have the ability to get this training. So what we do is they actually go around and they raised funds for a local hospital that has an infant CPR training room so that providers, nurses, paramedics, whoever is in need can go and be trained in the special room that's dedicated in their daughter's honor to care for other small infants. This is something that's a little bit more personal. You don't necessarily have a lot of data pieces to back that up. I would maybe find something on the number of infant injuries in childcare or in the early education setting, and just appeal mainly to the heart and the need to take action. So how can you fix this? You can make sure that all providers are trained and that they have the resources and the funds to attend that training. So that's the Gingerbread Model. It's a little bit easier to use in more of an emotional appeal. So something like Shayna's story is really much better suited to this. Does anyone have any questions on the two different models or anything? I think you can type them in the chat box if you have any questions on the two stories. And again, we have the worksheets in the handout section. Okay, I don't see anything, so I think we can move ahead. And we're going to talk about expanding your impact. So as providers and CCR&Rs, you talk to and have access to a large number of parents. Those parents may be just parents that you know, you have a relationship with, they drop off their children, you care for them, ask them how their day was. There's an opportunity there to get to know them a little bit better, to find out if they have needs that aren't being addressed, if they have concerns, if they've had other experiences. Maybe one of their other children has special needs and isn't able to attend your center or family child care home, and so has to be taken to a separate center from their sibling to get special care. Find out what those stories are. They could be great recruits for being a parent advocate, and I'm not saying you break any ethical rules or jump any boundaries, and as soon as you meet a parent, say, hey, would you like to advocate with us? But as you get to know these parents in your daily work, it is natural to kind of strike up conversations, to have stories, and to get to know their background. If you find that they do have concerns or showing interest in wanting to do something, definitely reach out and get them involved, because building a really robust parent and family advocacy network, and I know Washington actually has some really great advocates, it's really important because we go to the Hill all the time. Jake, who you heard from earlier, he's on the Hill just about every day talking to lawmakers. He does a really great job of painting a picture of why these laws are important, how we want to get them passed, sharing messaging and bullet points. But when you talk to a parent who is struggling and they live in your district and maybe they can't afford the quality care that they want, but they have to leave their kids with their neighbor because they don't have the money to pay for a child care center or a family child care home that they really want to take them to, that means something. They could be afraid every day that their child isn't getting the stimulation that they need or the education that they want for them in those really critical years. And so it's important to kind of connect those dots between what we're trying to get done and the why. And their stories are really the why of why we do this work. You'll see we have Betsy's story and Ellie's story linked here. They are two previous Child Care Aware of America advocates. They're pros at sharing their story. They've been doing this for years. And so it kind of connects the dots between why we do this work and what we want to get done. And for lawmakers, that is really key. If you are a nerd like me and you watch C-SPAN sometimes on TV when you're just looking for something to do, you may see people actually testifying in a committee hearing and sharing their personal stories. And those are the things that really move lawmakers to act. Okay, next slide. So when you're building your family advocate network and you have these great stories, how are you getting them out? If you're recruiting parents, you want to have something for them to do. You want to make sure that they're engaged and they're involved. And how do you share it? So a few of the ways are digital. Digital action centers. Child Care Aware of Washington does have one on social media and in blog posts. It could be, and we actually do this a lot at Child Care Aware of America too, is writing a blog post that's actually by a family advocate and then tying it into our ask, whether that's more funding for CCDBG or C Campus if they're a student parent, just kind of connecting those dots all in one place. And then in-person opportunities. So that could be a town hall, that could be a one-on-one with a legislator, like your state advocacy day or the Child Care Work Summit coming up in April. Could be a hearing. It could be they're actually looking for a parent to share a story in a small committee meeting because they want to try to convince other people on that committee. If you have a really passionate advocate, that is a great way to involve them and get them to share their stories so that you're kind of helping connect those dots for the lawmakers. Those are really, really key. It's not all family advocates want to share their story publicly, and that's totally fine. Not all advocates are there. but they could maybe take action on an action alert just via email by contacting their lawmaker, or they could share your posts on social media and try to get other people to sign on to a petition or to contact their legislators. There are so many ways for family advocates to get involved. It's just important that you give advocates multiple ways to do that so that they find the one that they connect with and that resonates most with them. We actually have a really great Family Voices blog run by our family and community engagement team. That's a great repository for childcare story examples, and it could be a place for you or one of your advocates to share their own if you do have an advocate that wants to do that at the national level. So definitely please reach out to us afterward. I'm sure our family and community engagement team would be thrilled to talk to them. But just as a note, to make sure that you do have multiple options. It doesn't always need to be sharing a personal story. Not everyone is in that place. Okay, next slide. And partnering for success. The third of the handouts is the stoplight messaging tool. And you'll see that that's going to help you work to align messaging between agency partners, community partners, coalition partners. We do this for a lot of reasons, amplifying your message to leaders and lawmakers and even the general public, making your group's impact feel larger when you're working in a larger coalition, and it keeps everyone on message. How do we get everyone on message? Is everyone on board with our actions? Those are questions you definitely want to ask as you're creating your coalition. We're going to talk next about some reasons why we would want to partner, because I know we have some pros and cons, so we'll just go over why we want to do this and maybe some disadvantages as well. So first, our advantages. I'm not going to read all of these. I'm sure you can read them, but partnering with other groups or coalitions gives us strength in numbers and protects some members that may not be able to take action alone. So specifically, if there's a hostile or difficult political environment in your state, if it's run by one party or another, and you're pushing something that maybe is antithesis to theirs, that's where it may give you a little bit of cover to bring in other partners who also do this work. You could also get more done by delegating work to others in the coalition. So we all know that providers and R&Rs are underfunded and overworked, as are a lot of us in this field. So it's great to have partners that maybe have some more funding or have more staff and are able to take on some things under the name of the common good. It also helps enhance credibility and influence of a campaign and the individual members of the coalition. So maybe nobody has ever heard of Kids Rock Washington, I made that up, but if you're joining a larger coalition and they say, oh, well, they're in with Child Care Aware of America and Children's Alliance and all of these other really big groups, that could actually kind of give you some credibility and some influence, and that's really helpful. And just diversity. So diversity can strengthen a campaign by broadening perspective and understanding of the issue. And it also assists outreach by appealing to a wider population base. So you could be reaching people that maybe have different priorities and interests, but some of that overlaps. In the early ed space, we often work with child health groups, child behavior groups, health and nutrition, and those things all overlap under general childhood wellness, child growth and development. And that's a great way to join in coalition on issues where you specifically agree. Now, some reasons why we may not want to, some disadvantages to partnering, because we want to be fair. It may be difficult to agree on common objectives, especially for groups that are similar but in scope, but maybe one leans more politically left or right than the other. It can take away from time working directly on campaign issues and organizational tasks. If it's a really large coalition, often managing those groups is very time consuming. So it's not for everyone. Power's not always equally distributed among members. So a really large organization may kind of suck a lot of air out of the room, take up a lot of the issues or the organizing space where you guys all should be sharing equally. Maybe a donor is interested in funding certain activities, but there's a danger of planning activities only because you know you can get the funds. So instead of doing what you're actually trying to prioritize, you kind of skew towards where a donor is likely going to try to give you money just because you want to get that money. Maybe that's not your priority. And then sometimes the coalition as a whole gets recognition rather than individual members who are doing the bulk of the work, or maybe certain members claim a recognition more than others and it causes conflict and resentment. Those are things we obviously try to avoid, but with large groups, you can't always control that kind of thing, especially if they're large coalitions. So just some disadvantages there. So we're going to talk about the stoplight messaging. This is that last tool in the webinar options here on the side. So you can talk about one issue in different ways for each kind of partner. If you talk about it in the same way with all of your partners and legislators and community members and advocates, you're not going to get very far. If you're trying to talk to a fiscally conservative state legislator and you're saying, you know, it's really expensive, but, you know, look at these great outcomes, that might not be persuasive to them. So we use this tool to kind of map out where our different partners may be on any particular legislative priority. So this just is a sample. These are all totally made up groups that I put in there. So maybe our sample priority is more subsidies for parents with infants in care. If this is a really expensive bill and you have lawmakers that are not on board, you're maybe approaching them with a different lens. So you have a Republican state lawmaker who is against it because they don't want to spend the money. Maybe you need to go to that person, that legislator, and say that you're making the business case for investment, that businesses are losing money because of child care breakdowns in the system, because parents can't afford it and they have to leave the workforce. You can make that argument to maybe a fiscally conservative person who is not on your side on this issue. If you have a legislator that's against funding requirements, then maybe you need to reassure that person that the requirements are already embedded in the program so they won't affect access. We don't want to bar families from actually getting this money, so we want to make sure that these are not prohibitive at all. Maybe you have partners, we call these in the yellow category, where they're sort of engaged and they kind of support you, but they need to be brought on board a little more. So I made up a group, Washington Kids Rock. Maybe they want a higher level of funding than we're comfortable asking for. Maybe they want $80 gazillion, and we're like, that's never going to pass. So we just focus generally more on the need for additional funds and the benefits for infants and toddlers, and less on a specific number. So we can all agree on, we need more robust funding at the state level for this program. It feels a little wishy-washy sometimes, but if your messaging is all the same on this issue and you can get more supporters, your coalition is going to feel a lot more larger and impressive to this legislator or to the coalition you're lobbying. So it's kind of good to get the yellow guys on board whenever you can. And then the green partners. These are totally with you. They agree with your messaging. So the way you reach out to them is by giving them sample social media posts, sample blog posts, sample newsletter content that they can share and ways to take action. If they're already on board with all of your messaging, have them go right to your action center and take action and share that with their own social media audiences. That's a great way to do it. You can have as many priorities on the left side of the tool as you want, and you just map out your partners and the different messaging. This is a great way to keep track of how you want to talk to different potential advocates or supporters on an issue. And even these guys in red, you really can't forget about them, because if you start getting momentum in your state legislature on an issue, they may be persuaded to join in if you can give them the right argument for it. So always mapping out your arguments on this stuff is really helpful, and this is just a tool we use to do that. I'm now going to turn it back to Lauren, who's going to introduce our social media manager. So if you have any questions on the messaging tool or the two story sharing models, just hit us up in the chat.
Awesome, thank you, Christy. And again, those handouts are all in the handouts section of this webinar, and we're also going to send them out via email tomorrow. In the interest of time, we're actually going to move the social media section of this webinar to next week's webinar, which brings me to my final slide if my computer doesn't freeze up, to talk about some next steps for you all. So thank you all for being here today and for joining us on this webinar. We are so excited that we're able to have another webinar next week on February 1st at 1 p.m. And that webinar, we're going to be talking about social media, using social media, talking about planning site visits with elected officials, planning meetings with elected officials, and building advocate networks. That seems like a lot to fit into 1 hour, but I promise effective storytelling is a lot of different all-encompassing things that you can then use on social media with elected officials, meetings, and building advocate networks as well. So this one was more give you lots of tools to then go do those things. And next week is really going to be, this is how you do this, X, Y, and Z, and this is how you do this, X, Y, and Z. So we're so excited to talk to you all next week again. And if you want other people to join you on this webinar, feel free to share the link. I'll make sure to share the registration link in tomorrow's email. If there's anything you'd like to hear on next week's webinar in addition, feel free to type it in, or if you reply to the webinar emails you've been getting, they will come to me as well, so I can respond to that. And I just want to thank you all for joining us today. And Marcia, I saw your comment. Thank you so much. This will be a really good comment. Marcia mentioned about when you're advocating for increased access to childcare, you want to make sure that you're talking about early childhood and childcare all across the spectrum, and talking about how important infant toddler care is. It's just as important as pre-K kind of thing. And I think that is something we'll really emphasize in next week's webinar, talking about social media as well. So thank you, Marcia. Well, I'm going to finish up right now, and I just want to thank you all for attending. If you have any questions, let us know. Look out for an email from us, and we look forward to seeing you on the webinar next week. Thank you, and have a great rest of your afternoon.